Oparanya has termed the healthcare workers' strike as illegal, warning them to return to work or face the consequences. This even as Health CS Mutahi Kagwe says that the ministry will not interfere in the employer-employee matter. Zainab Mohammed begins our broadcast tonight.
After months of back and forth between the health workers and the government, the fate of the frontliners is now clearly with the county governments who, according to CoG, are ready to fire the striking workers should they fail to terminate their strike.
County governments wish to reiterate that any health worker who absconds from duty will be dealt with in accordance with the law. Should expect to walk out of their jobs and then walk back when they do so wish. The county governments are not a revolving door. We are monitoring and shall circulate the names of the employees who have been terminated on account of indiscipline in order for the workers not to be considered for subsequent employment by other counties.
According to CoG Chair Wycliffe Oparanya, the health workers' strikes are illegal as they are not protected by the law. Oparanya further insisting that county governments do not have the financial capability to actualize the return to work formulas.
The court also issued interim orders to suspend the strike in the case filed by the Ministry of Health versus Kenya Union of Clinical Officers and Kenya National Union of Nurses and Kenya National Health Professional Society and others, as is the strike by the health workers is not protected in law.
And despite signing a return to work formula with the clinical officers on the 1st of January, the Ministry of Health has now changed its narrative, saying they will not interfere in the employer-employee matter.
As a parent ministry, we will serve as arbitrators. We will engage both county governments and the health workers so that we can bring out a harmonious working relationship. But we have no intention as a national government of usurping the role of the county governments as far as health management is concerned in accordance with the 4th schedule of our constitution.
Mutahi now says as an arbitrator, the Ministry of Health is pleading with the Council of Governors to resolve the matter as quickly as possible so as to avert the looming crisis.
We continue from a policy and philosophy point of view to urge that the county governments engage and agree on various working protocols with the healthcare workers.
The conflict between the national government and the county governments has now left the healthcare workers on their own with no tangible solution to their numerous demands. Zainab Mohammed, TV47, Nairobi.